Ohio University partnered with Amazaji, a fair trade learning organization that works with communities in more than 10 countries to bring you these stories of how COVID-19 impacted people around the world. Even though we're practicing physical distancing, it is essential to stay connected with the rest of the world. As you watch this video, acknowledge and reflect on the experiences each community member shares from this challenging time. December 31st, 2019. Health authorities in Wuhan, China reported that they were treating dozens of patients diagnosed with severe pneumonia of unknown causes. On the same day, hundreds of millions of people around the world shared excitement for the arrival of a new year.
First, I was hoping that 2020 would be a great year. I was hoping that I would work less, but actually I'm a doctor and I'm sure it didn't happen.
I was hoping that 2020 would bring new opportunities for personal travel.
In January this year, my husband and I had plans to take our children on a tour around New Zealand.
I was hoping that 2020 would be the year of our strengthening as an organization.
Thought that in January we would be able to stabilize a lot of things that we had been working on for previous years, that we would have accomplished, overcoming several challenges, particularly Hurricane Maria.
My hopes for 2020 were teach more students and find new friends for the new year, and hopefully have a healthy year.
Days later, researchers in China identified a new virus infecting people in Wuhan, causing fever and serious issues like difficulty breathing and pneumonia. On January 11th, China confirmed its first death from the new virus, raising health concerns across the globe. On January 20th, the first case of the new virus was diagnosed in the United States. As the new year unfolded, news outlets began to broadcast a worldwide catastrophic scenario. More and more countries reporting cases of the virus, people infected and dying at an alarming rate. On January 30th, the virus was officially declared a global health emergency. On February 11th, the World Health Organization announced a name for the disease caused by this new virus, a name that will be found in the history books, COVID-19, an acronym that stands for Coronavirus Disease 2019. This coronavirus is a new strain, but it is from a family of viruses that can be found everywhere and causes illnesses including the common cold. The World Health Organization was intentional with naming this virus to avoid stigmatizing a specific region or country. The COVID-19 pandemic has impacted everyone worldwide, regardless of race, gender, nationality, or economic status, though some communities have been hit harder than others. This pandemic led to a range of public health responses, from promoting physical distancing to mandating the use of face masks to enforcing complete lockdowns, all with the same goal in mind, to slow the spread of the virus. This is the new normal until a vaccine is developed and its treatment is widely distributed.
So I guess it is the same way in the whole world, in every country. In the beginning it was crazy. No one knows the next day.
Confusing and a lot of anxiety because we were watching images of what was happening in Italy.
Italy was the earliest European country to be struck by the pandemic in late February. It took time to fully understand the magnitude of the threat and to adjust to new rules and habits. During the first couple of weeks after the discovery of the early Italian cases, everyday life outside the localized hotbeds of the virus remained about the same for most people.
And we were afraid that would happen here, and there is a great lack of confidence in the government and how the government managed Hurricane Maria and the earthquakes. And so we thought that they would not manage correctly either the pandemic. However, they did make a decision to establish a lockdown, the first lockdown in all of US jurisdictions.
It took a while for COVID-19 to cross our borders, since we're an island country. However, that didn't dismiss the issue that was growing globally and impacting the students on ground and their families back home. In New Zealand, we were a bit in denial at first because we felt this was the safest country to be during a pandemic. However, community transmission was identified not too much later on.
But I guess in the beginning, the first days of the pandemic, the people here in Brazil, the people here in the Amazon was respecting the mask policy, the physical distance, the lockdown. But by the first time, our president Jair Bolsonaro went to the television to speak to every Brazilian and despising underestimating the pandemic. Slowly the people began to stop to respect all the policies, all the measures of the quarantine.
The first days of the pandemic I cannot remember. I myself, probably just like everybody else, just kind of wrote it off and said, oh well, that'll happen then somewhere else, and didn't take it too seriously until people started really getting sick.
Governments around the world reacted differently to the pandemic. Some leaders quickly took action based on health experts' recommendations, implementing new policies and providing useful resources. Others denied the global health emergency as long as possible, treating it as a hoax, which only increased the tragedy.
The central government tried to contain the spread of the virus, isolating the small towns in northern Italy in which the first cases were detected at the end of February. However, national and local authorities were not prompt and resolute enough to immediately take more comprehensive decisions. For instance, in early March, schools were closed for 3 days, reopened for 2, and then closed indefinitely. In our region, which is one of the main European destinations for winter tourism, ski resorts were not closed until March 11th, and so the virus ended up spreading quickly. Then we had almost 2 full months of strict lockdown.
I believe that our Prime Minister Jacinda Ardern has done an excellent job in taking care of New Zealand. She's been very clear and kept updates often and whenever needed alongside our Health Minister. When we went into Alert Level 4, all shops that were not necessary were closed immediately and only essential workers were allowed to work. Health and safety was put in place immediately also, and if you were out and about, face masks were to be worn. They were encouraged. Hand sanitizer and also gloves, social distancing. Homeschooling was put in place. Children were given resources to homeschool at home. Organisations were given more funding to do their roles immediately and effectively, and also essential workers were given extra pay and those on low incomes.
You're asking me how the government respond to the pandemic here in Brazil. There's a difference. The local and regional governments, they were good at all at the beginning. They built some field hospitals, a lot of public health facilities to try to respond to the pandemic, and for forcing some lockdowns, emphasize the physical distance and other measures that we know is worth. But the national government is a tragedy, is a tragedy, don't matter. Jair Bolsonaro and his whole team and supporters, they are always trying to say that the quarantine is bad, that the solution of the COVID is hydroxychloroquine, and if you don't use it and you are against Jair Bolsonaro, they said how you are cheering against Brazil, so you want that Brazil goes bad. And it's not. We know we have more than 100,000 deaths here.
By September 15th, 2020, reports indicated over 29 million people were infected and over 929,000 have passed because of this disease. Months of uncertainty, global do not travel warnings, and widespread business and border closures meant recessions for wealthy nations and economic chaos for developing countries. As governments struggled to contain the virus's spread within their countries, populations had to adjust to their new realities. Leaders grappled with questions like how to provide basic needs, how to continue education when everyone must practice physical distancing. Many parts of the world faced these difficult questions while still recovering from recent tragedies and already lacking resources, but creative solutions were born.
So when the pandemic was going on, the governor of Puerto Rico decided that there was going to be a complete lockdown, like absolute complete lockdown. You couldn't go out of your house unless you had like a doctor's appointment. You had to go buy medicine, or you were going to buy food at the supermarket. Otherwise, the policemen would send you back to your home. They were being very strict. You couldn't be driving. There couldn't be more than one person in the car. So it really made everything very complicated in terms of how to be on the street to be able to get to the communities to provide services, especially with our students. How do we make sure that they receive their modules to be able to study because they don't have internet connection? How do we support our students from the after-school programs to do their homework? But also, how do we create activities that our students can do? I'm sitting in my house, I'm looking out the window, and I see the mailman. And that's how we're going to do it. We're going to send everything through the mail. And so I called a foundation that has been very supportive of us. And I said, do you think you can give me a grant so I can buy some stamps to send packages in the mail? And they said yes. And of course we have a wonderful team of vibrant people who love to make things happen. And we had a conversation. I said, well, we have a challenge. We need to get arts and craft supplies and academic material in the mail to our students. So we need to figure out their mailing addresses. We need to figure out how to pack everything, and then we need to send it in the mail. When the mailman comes, you're going to give him the packages and he'll take them. And that sounds very simple, but it actually turned out to be one of the most complicated things we've ever tried to do. Apparently there's a lot of rules and regulations of what you can ship in what type of package, how many things you can put in there, the weight. And I was very concerned of having people staying in their house and doing this from their house. But of course, we always have champions who are very committed to the cause, and two of them showed up to the post office and stayed in the post office until the mailman explained to them how to do everything. And we were at other post offices, etc., etc. It was a mess, but we got it done.
Stories like the one told by Michael Fernandez shed light on how people worldwide are finding ways to overcome COVID-19. In these pandemic times, ordinary communities in the U.S. and abroad are constantly challenged to continue our lives as best as we can. Some of us are fortunate to be able to do this from home, but many of us must go out to support ourselves and our families every day, and we know it's a risk.
Italy ended the generalized lockdown earlier than most countries, at the beginning of May. Summertime brought the opportunity to return to a certain degree of normalcy in some sectors. Many businesses reopened, domestic travel for leisure returned, the use of masks was only required in certain situations. In general, there is a mixture of relaxation in the present and concern for the future. Currently, social distancing rules are often violated, maybe as a reaction to the collective trauma that we experience. At the same time, there is much preoccupation with the reopening of schools, for example, and of course with the long-term economic consequences of the pandemic.
In the last 3 weeks, I guess, the social distance in Brazil is terrible. Everyone is going to the streets, everyone is going to the beaches. There are some parties around the country, and the people are traveling, and I guess the social distancing more monthly will not exist at all in Brazil.
I think that 9 months after the pandemic, people are most definitely fatigued, emotionally, mentally, physically. And for us particularly, we have several instances, the Hurricane Maria, political unrest, earthquakes, and the pandemic, but all within a context of economic depression and downfall of the country and the government. So there's a lot of stress.
So we are now back in level 2. Restrictions, which now just feels like the normal life for most people.
it also impacted a lot of ceremonies on the reservation. A lot of the ceremonies are very sociable happenings, and we haven't had any, as far as I know, the big ones, and some new ceremonies that come up every year, seasonal ceremonies. So those, we'll see how those go when the time comes.
The COVID-19 pandemic has impacted everyone worldwide, regardless of race, gender, nationality, or economic status, though some communities have been hit much harder than others. It reshapes our lives on an unprecedented level. It alters the ways we interact with our loved ones. It shifts our perception of the world we live in. It changes our plans for the future. What lasting impact will COVID-19 have? What changes will remain with us after this pandemic ends?
That is a positive that I see from this pandemic, is that it has grown people closer and got us to use the knowledge that we've always had instead of relying on simply going out and buying it. And if anything, those are the things that I take out of this, and also being with my children more and using whatever resources we have around the house to homeschool.
One of my major concerns is that the general impact of the pandemic will lead to increasing inequalities, locally and globally. In Italy, there is a growing polarization, for example, between those who have a secure job and were not damaged by the pandemic and the lockdown, and those who are self-employed or have temporary jobs, who suddenly lost most, if not all, of their income and plans for the future.
This pandemic showed me that our community must fight for the maintenance of our public health system called SUS. He is free, he is universal. Even if you American came here to Brazil, you can use it for free at all. And we know that a lot of people were killed in the COVID, but a lot of people who survived it was because of the SUS. Not only the hospitals, this kind of facilities, but the testings, the measures, the epidemiology, they are all granted by SUS, our public health system.
What our community needs for overcoming the pandemic is a lot of what everybody else needs, which is a lot of support, to be accompanied, and the basic things that everybody else needs as well: masks, alcohol, disinfectant, capacity to be able to connect online. For example, our students at least don't have that access to internet or equipment. And I would imagine that we all need a lot of patience, because it doesn't seem like this is going to be going away anytime soon.
Well, a lot of people died. A lot of first responders are gone now. A lot of young people, a lot of old people too, and so that's kind of the sad part about it. What would I tell college students? You're not invincible, so don't all bunch up at one place and have a party or whatever. I can't make it any. I can't say it any plainer than that. Keep your distance. Keep your masks on, and hopefully, this doesn't last too much longer. All right.
Everyone plays a part in overcoming this pandemic, whether by being a frontline worker or practicing physical distancing. One single step towards virus prevention can resonate around the world. Each step brings us closer to beating this virus. It's time to ask yourself, are you doing your part?